So we want to talk a little bit about incision placement for biopolymer surgery. So it's a very complicated topic, and a lot of patients have a lot of confusion about it. Here's kind of the overall viewpoint of it. So as we place incision placement, the ideal point of what we're trying to do is we're trying to create the most aesthetic incision placement for maximum silicone extraction. So oftentimes we start out with a thong-like, or what is called a butterfly incision. Now the goal of that is you have to be able to raise the flap up, get as much silicone out, and remove the most amount of silicone. However, that is really dependent on what the MRI is, what your physical exam is, and the location of the silicone. So oftentimes we choose between an incision that goes like this or an incision that goes like this. And the reason why we do the incision that goes like this is because we want to take the most amount of silicone as possible. It doesn't make sense leaving silicone in the buttocks to have a nicer incision. And it's always confusion between patients, and I think patients think, oh, we can have a higher incision. Having a higher incision is easier. You take out less silicone, less tough dissection. That's the easiest thing to do. But if you're doing it in the wrong patient, you're sacrificing their health for an incision, and that doesn't really make sense. As being a double board certified plastic surgeon, you want to do the best job for your patients. So we're always going to try and make the incision as best as possible, but I'm never going to make an incision up high that looks good knowing that I'm leaving a lot more silicone in there. It just doesn't make sense. Then you get into more complicated incision placement, and that's usually when patients have necrotic skin, huge areas where the blood supply doesn't look good, and often in those positions you have to change the way you make your incisions. So oftentimes, sometimes we have to make an incision like this, sometimes you have different kinds of incisions. That usually is patient to patient dependent. So if you have a lot of skin, has terrible blood supply, it doesn't look like it's going to heal well, you have to change the way you design it. I tell people all the time, something about biopolymer surgery is like every patient, every surgery, it's always different. I mean, every case has something different, a new element that I have to adjust to make the patient, to give them the best result possible. So what I try to urge patients is understand that your incision placement most often will be done in an aesthetic fashion. However, I'm never going to make a nicer looking incision and leave silicone in there. That's the easiest thing to do, but it's definitely the wrong thing to do.